Hello and welcome to today's episode of Health University, where I have the pleasure of interviewing and conversing with my friend and colleague, Dr. Sanda Moldovan. And Dr. Sanda is a double board certified periodontist, a double board certified periodontist and nutritionist. I tried to say that all at once in the Beverly Hills area of California. She is committed to natural oral health and well-being, and as such, she is a biological dentist and the founder of Orasana, a natural oral health product line. She also educates health professionals on learning about the importance between gut microbiome and oral health, and I presume vice versa. And she has her own podcast called the Holistic Dentistry Show podcast and a book called Heal Up: 7 Ways to Faster Healing and Optimum Health, which inspires holistic wellness. If I've missed anything in this very impressive bio, please feel free to add on anything, Dr. Sanda. And I'm so grateful to have you here and to talk with the listeners about the importance of their oral microbiome and oral health and their fertility. So welcome.
Thank you so much, Susan. Thank you for having me. I mean, you got it right. I'm very passionate about oral health and how it's connected to overall health. And we have such a power, especially when it comes to fertility and the newborn baby, to really take care of our mouths to have a better outcome.
Yeah, absolutely. So what about this oral microbiome? Tell us about it. And is it at all different from our gut microbiome or our vaginal and uterine microbiome, or is it just part of the same chain of communication?
Actually, both. It is part of the same chain of communication. And we do think there is some kind of communication between colonies. We don't know exactly how, but the oral microbiome is slightly different in terms of what, let's say, oral probiotics or what are the beneficial bacteria that help protect against cavities and against gum disease.
Mm-hmm.
I became hugely passionate about the oral microbiome because I wanted to understand how it could benefit us. So first, I learned about the gut microbiome from the Institute of Functional Medicine. I'm like, okay, well, what about the oral? Nobody's really talking about it. And we know a lot more, but still not enough about the oral microbiome. But we do know enough for us to understand that if we do not have a healthy microbiome, we're not going to have a healthy mouth.
Mm-hmm. And if we don't have a healthy mouth, we're not going to have a healthy body.
Exactly right. So
Mm-hmm.
it's all connected, and we know the strains of bacteria now that are involved in health and the ones that are involved in disease. And we have simple tests today to test this oral microbiome. So if somebody comes to me with gum disease or cavities or candida, for example, the first thing I do is do a saliva test to test the oral microbiome. What is it telling us? What is in imbalance there?
Mm-hmm.
And once we find out what kind of microbes are out of balance, or maybe the microbes that shouldn't be there,
Mm-hmm.
then we start to reset that balance to get it back into health.
Mm-hmm. And are you doing this concurrent with other procedures that a patient may need? A cleaning, an extraction, a root canal, or whatever, a removal of amalgams, and we will get into that, I hope, in a little bit more detail, especially for the fertility and pregnancy population.
Yeah, absolutely. Great question. So for us, the oral microbiome reset comes first because
Okay.
it's the terrain. It's like the soil that you're growing your vegetables in, the soil that we're holding the teeth in.
Mm-hmm.
And it must be healthy before we proceed. And so
Mm-hmm.
if somebody comes to us, for example, with cavities on every tooth, we don't just start drilling. We're like,
Yeah.
okay, what is the oral microbiome? How can we reset it back to health? By using non-surgical products, by
Mm-hmm.
strengthening the teeth, and then we see the cavities that are really deep that we have to drill on. Because the worst time to really drill on the teeth is when they're actually sick, right? When you have a disease, that's not when you intervene.
Yeah.
We
Yeah.
got to make things stronger first,
Mm-hmm.
and then we can do the treatment. So oral microbiome first, then we take care of any kind of cavities or mercury toxicity, and then we move after that into jawbone cavitations and root canal teeth.
Okay. All right. I imagine that this is a question you get asked a lot. How long does it take to reset the oral microbiome, and what are the processes to get there?
So after we do the saliva test, which takes about 5 to 7 days for us to get the results back, then we look to see, okay, does it require an intervention in the office? Most of the times it does, but not every time.
Okay.
And it's always, we have this, holistic approach,
Yes.
integrative approach. We start things in the office. Usually we do a full mouth detoxification, and it's not surgical. It's a procedure that our hygienists do through the use of, it's called airflow therapy, which is a Swiss technology to help basically wipe off the entire microbiome of the mouth, including from the tongue, from the cheeks, from the teeth and the gums, underneath the tongue. We wipe it all away. And then we introduce beneficial bacteria through the form of chewable probiotic, through the form of good oral hygiene practices, meaning brushing, flossing, chewable probiotic. And then we see how things change. And typically within 3 months, we see drastic changes by just working on the gums and on the microbiome when it comes not only to cavities, but also to gum disease.
Beautiful. And then are those patients also seeing themselves feeling better in their mouth? And chewable oral probiotics. I want to hear a little bit more about that. And are they in your line?
Yeah, definitely. And the patients feel definitely better. This is the amazing thing. Like people that have had, let's say, rheumatoid arthritis, because one of the bacteria that we find in saliva has been linked to rheumatoid arthritis. Sometimes they see, oh, you know what? I have clearer mind. I don't feel as tired, because diseases in the mouth are infectious diseases, whether it's gum disease or cavities. Exactly. So people feel better. And the chewable probiotic that I'm passionate about, of course, is because I created it out of a need of creating a better tasting probiotic. There's a lot of probiotics out there that don't taste good. They're chalky tasting and they don't have an effect. So ours, I'm proud to say even kids love it. They all usually ask us, well, how many of these can I have? Can I have like 10? No, we can't have 10. So we know we got the formula right. It's vegan certified, and you can find Orasana probiotics also at Air One markets in California.
But we can get it online.
Online at orasana.com or on Amazon.
Excellent. And so now that we're in the realm of oral probiotics, that chewable probiotics that everybody's loving, and did I hear you say they chew it once a day, or is it twice a day with each brushing?
Twice a day would be ideal.
Gotcha.
Yes.
Okay. Let's talk for a second, and I don't want you to fall off your chair, about what is otherwise out there in the market for toothpaste, mouthwash, etc., and why someone wants to run far, far, far away from that.
Absolutely. I actually had to do an NBC segment, toxins in your toothpaste. This was a few years ago. And unfortunately, things haven't changed much. Maybe the only thing that's changed is that we have a few more options in the natural toothpaste. But the majority of the population, they're still using toothpaste with toxic chemicals. And the problem with the mouth, especially underneath the tongue, the mucosa is so thin, everything gets absorbed in our body. People think, oh, I'm just brushing with toothpaste. Yeah, but a little bit twice a day over the course of years, let's say propylene glycol. It's an antifreeze. And that's in a lot of toothpaste. Then we have also...
Why is someone adding antifreeze to toothpaste?
They're just using it, I think, as a preservative, especially propylene glycol. And even I found a brand of children's toothpaste. It actually said on it naturals, and it had propylene glycol in it. So I'm like, wow, it's like even you have to read the ingredients and everything.
Right.
Because even if it says naturals on the label, it doesn't mean that it's 100% natural.
Right. And would you agree that if you're reading those ingredients and you cannot pronounce them, put it back and choose something else? Because there's nothing natural about that.
I agree 100%. And you also don't want to use a toothpaste that has harsh chemicals. Like there's toothpaste out there with chlorhexidine in it, which is toxic. It actually kills cells. And also toothpaste with stannous fluoride, for example, that's also like marketed for periodontal disease. It kills everything essentially. So we don't want to kill everything all the time. we want to balance the microbiome. So it's a different concept. We're outnumbered. There's 10 times more bacteria than human cells. So we have to take care of our good bacteria because they will take care of us. So we can't just kill them all the
We have
time.
to be good hosts.
That's right. We have to be good hosts, definitely.
So, and then there are some folks who might say, well, okay, then maybe I'll just use baking soda. Why would that not be the right idea?
Baking soda is actually not bad. I'm glad you brought it up.
Okay.
So you can actually sprinkle on your toothpaste a little bit of baking soda. It'll help to whiten teeth, which is nice. Everybody wants a beautiful, bright smile. So actually, that's one of the ways that I recommend people to brighten their smile is
Okay.
with baking soda.
Okay. All right.
Yeah.
I wondered, would it be too harsh? An abrasive, at the gum line. Is that just I'm making that up? But it's
Great question. Yeah. Is it too abrasive? I don't find it to be too abrasive, but the toothbrush on its own, with or without baking soda, can be too abrasive if we scrub the gum line too hard. So for people that have gum recession, I definitely recommend just using a manual brush, not an electric, in small circular motions for the toothbrush, because electric brushes just by themselves have been shown to cause some recession in people with thin
interesting.
gums.
Very interesting. So, and there's almost a tug of war in the field of dentistry between use the manual, the soft brushes, or use the sonic because it's giving some extra ultrasound or something with its movement to clean the teeth better. But what I hear you saying is if you've got any kind of recession, then you're the candidate for using the soft bristled manual toothbrush. And then here again, we're talking with toothbrushes. I imagine they're not all alike. You want to make sure you're choosing a toothbrush where you're not putting a bristle up under your gum line that is covered in plastic.
So true. So this is the scoop on brushing
Let's
and
hear.
looking at all the research, because part of the resident, being a periodontal resident, we have to look at all the research on brushing and flossing. So electric brushes are of two categories. They're the sonic kind or the rotational kind. Let's say like an Oral-B, where basically the brush head just rotates back and forth. Sonic-like brush bristles basically vibrate. The rotational ones are the worst ones in terms of gum, scrubbing, because they scrub the gum and over time they can definitely create more recession. And sonic type brushes I've seen them work really well in some people and really poorly in others. Or some people, they don't work well at all because people don't change their brush heads every 3 months, like the recommendation. So it depends for everyone, but sonic care brushes initially were good for people with dexterity, like with poor dexterity. So I do recommend it. If you find that you're having a hard time brushing because of dexterity, definitely use an electric brush. But for most people, what I find is that a manual brush works great. I find they pay a little bit more attention, and also combined with a water flosser.
Okay, water flosser. I want to talk more about that.
Definitely. I find the two together work really well.
Okay. So flossing, there's the manual sort of, piece of string, oftentimes, once again, covered in plastic. So let's make sure you don't use that. And then water flossing. Talk to us about both of these things.
Definitely. I'm glad you brought that up because Glide floss actually there was a study done to show that people who use Glide floss had an increase in PTFE in their blood. And PTFE is basically Teflon, right? And Glide floss is coated with Teflon. A lot of people don't know that. So this study actually made the news, but somehow it got buried, and I still see Glide floss being sold. I think people forgot about it.
Yeah.
But why do people like Glide floss? Because it glides in between the teeth very easily. However, it doesn't clean anyway.
Right. It's not doing the job. It's not picking up any of the plaque that needs to be the purpose of flossing.
Absolutely. So there's some good flosses out there, but make sure if you use a string floss, use it correctly. Wrap it around like a C around the front and back tooth, sideways, up and down. A lot of people just snap it in between. So it doesn't really clean. What we find instead is floss cuts. So when we snap the floss in between the teeth very hard, it goes down And I look at people and I could actually see floss cuts where they're hurting their own gum
Wow.
from flossing. And I
Wow.
point it out to them. I'm like, you're going to get gum recession. And when the gums recede, we also lose bone, which is
Hmm.
not good. So for most people, what we do find, and actually in Europe, it's a standard of care for everybody to use a water flosser instead of string floss.
Okay, so where do you find a water flosser and which ones are best?
Orasana.com, we have a
Okay.
portable water flosser. Why did I work on this? Because I didn't like the brush heads that exist with other flossers, with
Mhm.
other water flossers, because a lot of people, when you use a water flosser, you have to hold it a certain distance from the gum, and people never know what distance that is. Some people hold it too far out, some people too close. So
Mhm.
so ours have these little fine tufts that you hold it at the gum line and actually points the jet where it should go, which is
Good,
at the gum line and just under the gum line, so
good.
that it cleans properly. So I think ours is easier to use and just more
Well,
effective.
and if it's easier to use, then people will use it and will use it for the right duration between all the teeth, as opposed to a 1 minute, okay, got it in there, got it out. Now I'll go to bed and let all of that bacteria populate
Yeah.
overnight.
Exactly. So really 90 seconds it takes for a water flosser to be done correctly and really walk it along all teeth. And even though it's called a water flosser, it really cleans 360 degrees
Mhm.
instead of just in between, which is an
Excellent. And it's
benefit.
just water. So you're having people use like a distilled water or something like that?
Yeah, distilled water is great. You can use spring water. You can use ozonated water
Mhm.
if you
Mhm.
have some suffering from bleeding gums.
Mhm.
But all the studies that we have so far on different water flossers types and models were done on a medium power with just water, and it's been found to be a lot more effective than string floss on its own.
Okay, good. Duly noted. And then what, like some people have sensitivities. So with are you able to sort of warm up the water or yeah, okay, great. So
Absolutely.
the
Yeah,
canister will hold warmer water as well.
absolutely. Like I personally, I'm not crazy about using cold water on my teeth either. It just doesn't feel good.
Yeah,
But
yeah.
yeah, I definitely prefer. I have
Okay.
a full house filtration system, so if you do, just use the warmer water on your faucet.
Okay. Okay. Thank you for sharing in our conversation here at Health University. One of the ways in which we help people improve their fertility is through our 5-element fertility quiz. Please click on the link below at yourfertilityquiz.com and take the short quiz. You'll receive a free report that includes easy to implement ideas to improve your whole health and your fertile health. Now let's return to our topic in today's episode. And then now, like mouthwash, mints, breath, the breath mints kind of stuff. Tell us about, your experience in the chair looking at someone who's been using the wrong kind, why it's the wrong kind, what is the right kind, and what they might do otherwise for mints or gum or something like that if they need a quick, freshening up of their breath.
Yeah, when you're using mints or gum, just look at the ingredients again. We don't want to use something that's toxic for the same reason that I mentioned earlier. And a lot of the mints, unfortunately, have FDIC blue and they have colorants and artificial like aspartame and different things. So just make sure you choose a more natural product.
Like
And
xylitol, would you be
yes, I
great?
love xylitol, and I
Great.
mean mints are with xylitol, and in small amounts, it's actually been shown to be very beneficial, especially for people that build a lot of plaque.
Mm-hmm.
People build a lot of plaque. Anything with xylitol will actually be super beneficial.
Great. I hope that we get that on Orsana as well.
Yes,
Okay.
absolutely.
Okay.
Uh,
And so
mouth,
then people who are like popping that like Listerine strip in their mouth or taking a mouthwash that you can actually feel that it hurts. And it's almost like they numb, there's a numbing agent in the mouthwash itself so that you can't quite feel just how harsh it is on your oral cavity.
yeah, exactly. Listerine is one of those mouthwashes, and for me, it burns my mouth whenever I use it. And part of that is the alcohol. And
Mm-hmm.
alcohol mouthwashes are not good to use because alcohol denatures cells and
Mm-hmm.
actually increases
Mm-hmm.
cancer risk.
Interesting.
I would not recommend anybody. So if you're going to choose a mouthwash, make sure it's natural. Essential oils are fine. However, it's just mostly for flavor. You don't want to use anything too strong that's going to kill your microbiome.
Right,
Some
right.
of the products with tea tree oil out there, or
Mm,
people using just plain essential oils on their gums, that's
mm,
too much. It's
caustic.
too much.
Yeah, yeah.
Yeah.
Well, I mean, I was just thinking to myself, I mean, who might consider like putting some alcohol and rinse, out of the bottle and rinsing? No, you wouldn't. So, but you're doing that with all of these other chemicals, thinking that you're doing yourself a favor.
Actually, so, good you brought that up. A few years ago, I actually measured the pH of Listerine, of the
Hmm.
alcoholic Listerine.
Hmm.
It was around 3, the pH. It's basically like swishing with wine. And who swishes with wine for 30 seconds?
Yeah, no.
Nobody. You do that. And the problem with that is like those people also tend to have sensitivity
Yeah.
because when the pH is that low, you're going to have tooth sensitivity. So just if you do have tooth sensitivity, look at your products and try to discontinue and add something that's alkaline or based or that mineralizes teeth.
Excellent. And I began this all by saying what's its connection to fertility, because this is kind of our general conversation. And then I took us down a little bit of a sideways path, but I think it's really important to detail all of these things. But let's circle back. So if there's an important, nugget that you want to make sure people understand between the link of their oral health and their reproductive health, let's hear it.
Yeah, and I encourage all moms out there that are or future moms that are thinking about getting pregnant. This is a time for you to get your body ready, not and your mouth ready, not just your body. I know, Susan, you do a great job getting people prepared with their body. But in terms when it comes for your mouth, your microbiome definitely hugely important. So start taking care of your oral hygiene twice a day, every day, brush, water floss, chewable probiotic. And even that, you're going to be able to feel a big difference. But
Mhm.
also make sure you don't have any periodontal disease. Studies in the 80s were shown that periodontal bacteria causes actually for you to have a preterm low birth weight baby.
Mm.
And bacteria from the mouth has been found inside the fluid.
Mhm. Mhm.
So the amniotic fluid.
Yes.
So I highly encourage you, make sure you have no periodontal disease, get your cleanings regularly, even when you're pregnant. And
Hmm.
secondly, make sure you have your mercury fillings removed
Thank you.
prior
Yeah.
to conceiving.
Yeah. And then I just got chills. How long would you, both ideally and then minimally, recommend someone wait between they having their amalgams removed and then trying to conceive? Is there, or is there not really any studies that indicate how long one should wait?
But for me, my preference, I don't know if there's any studies, but the preference is always to do a mercury toxicity test, like
Mm.
either a urine challenge test, to see is your mercury now low enough, or how high is the mercury in the body. I've had patients that have had only 1 or 2 fillings, and their mercury toxicity in the body was not very high.
Okay.
But I've had patients with a lot of fillings with high toxicity, and they take them longer to detoxify.
Mhm. Okay.
So it depends. The sooner people start the process of detoxification, the better.
Hmm.
And I think that's when, somebody like you would kind of take that lead and see, okay, is your mercury low enough? Is your heavy metal load low enough for you to have a
Hmm.
healthy baby?
Hmm. Yep. Yep.
Also
Because
had,
it's all getting passed along to the baby who does not yet have, a skull. So it's going right into, nervous system, circulatory system, its own hormonal system, endocrine system. So yeah.
oh, yeah. The third thing that I wanted to mention with
Mhm.
fertility is chronic infections of the mouth that sometimes people just either they're not bothering them enough. Like let's say root canal has gone bad.
Mhm.
Sometimes root canals that have gone bad, and what do I mean by gone bad? They're infested with bacteria. And how can you tell? You can take a look at your teeth, and if you see something black, a root canal that you've had maybe starting to turn black, it's time to take it out. Because, and I've
That's
seen a lot of
necrosis, isn't it? That's healthy tissue gone necrotic.
yeah. 100%. And I take, unfortunately, out so many root canal teeth. And when I take them out, even the bone around it is necrotic.
Mm,
So when your body is in fight or flight because of a chronic infection, because that's what happens, uh, how can you conceive properly?
right, right.
So what we find is some of our patients came to us, cleaned out the root canal infected teeth, and then they had an easier time conceiving after that.
That's beautiful. Easier time conceiving, great. Healthy baby. That's the end game, right? I mean, we don't want just a positive pregnancy test. I don't think anybody tries to conceive just for that positive pregnancy test. We want a healthy baby, a healthy postpartum. Now, here's a question, because I was just going to say in the postpartum, does an infected oral microbiome affect breast milk?
Absolutely, it does,
Yeah,
because it will travel. Again, all the microbes travel throughout our body.
yeah,
Anytime gums bleed, bacteria from the mouth will transfer into the bloodstream, can definitely, go around all of our fluids.
yeah.
Uh, so very, very important. I mean, even, when you're talking about oral bacteria, we found them on the vaginal end. How
Wow.
does it get there? We don't know, but we know that they do
Yeah.
travel.
Well, as you say, they travel. They are live organisms, and so they'll go where they can. They'll go where they can hitch a ride.
Yes. And also, there was actually a couple of actresses. One of them was Alicia Silverstone. She was
Mhm.
talking about chewing the food for your baby and
Mm,
giving it to them.
mm,
And I said, okay, well, is your mouth healthy enough?
yeah, yeah.
Do you
That
have
that
bleeding
that
gums?
my just natural reflex for that is no, we are not birds.
Yeah. Yeah. She said how she did this for her baby a few years ago. I'm like, wow.
Okay. All right. Well,
Yeah,
there's something for everyone, but you're not getting recommendations on
no,
on this podcast, listeners. So,
definitely not.
well, I could go on for a long while. This has been really fun, and I really appreciate the detail, the leveling up or drilling down, pun intended, as to what people can do, what they can look out for, what they can do, what they should avoid. I will make sure that Orsana is in the show notes so people can just click on through. And I really can't thank you enough for taking this time, because we don't think above the neck. Usually when we're thinking about having a baby, we usually don't think about the above the belly button. But yeah, we certainly do need to consider that our oral health is our whole health, is our reproductive health. So with that, I'm going to let you go back to probably taking care of some more patients. Listeners, thank you so much for listening. Feel free to reach out to Dr. Sanda. Her website will be in the show notes as well. And then the Orsana, so you can buy all the right things and make a change for yourself, your partner, your family, and everybody's future health. So with that, we will just say what we often say at the end of our episodes at Health University, class dismissed.
Thank you.